Hi, my name is Joshua Reiner, and I'm here to talk to you about Purewick female catheters. Now, the Purewick female catheter is an innovative product that cuts down and possibly eliminates the chances of women who need catheters um, from getting uh, urinary tract infections. Now, that's really the objective of it is to cut down on infection, cut down on hospitalization time, future problems, and our objective is to reduce the chance of urinary tract infections, to reduce the supply of needed for incontinence pads, wipes, all that stuff adds up, and we want to decrease the chance for antibiotics to be used in with the infections. Um, Antibiotics are handed out like candy sometimes, understandably because of these infections. And we want to reduce waste in the environment with these wipes and incontinence pads, all that stuff. All hospital waste just goes right into the landfills. And we also want to give the patient more dignity as opposed to just, wetting the bed or using bed pans after. Our main people are people who have had surgeries or are elderly and or have broken hips and pelvic bones. Um, some of them are just very overweight and can't get out of bed. Um, Bedpans don't work for them. We want to give them some dignity. We want them to know that they're not going to be laying in their own urine. So that's the objective. Now, the opportunity that we have here is we want to create a test group to to try these out. We want to have a test group done for qualifying patients that will be able to know what's going on, and they will see how they like it and how it works for the staff, for the nursing and doctor staff. Um, and the opportunity to provide a catheter that can reduce the amount of incontinence and amount of waste. And this will also reduce the amount of prescription drugs used to treat urinary tract infections. That's our opportunity, is to make everything better for these people. So our solution here is we're going to coordinate with a local hospital. We would like to coordinate with you, Unity Point Meritor, to run a trial on different floors and tell us what you think. We want to do all the different floors. We want to start with just general med all the way to ICU. And I'll get to that in a minute, how we're going to do that. But we want to prolong the long lives of the elderly and the mobile patients, and that's our solution. And then we want to lessen the expensive medications and medical treatments. Now, I've grown to have an understanding of these with this by observing with my time as a nursing assistant and a brief period of time as a nurse. Um, and I just want to make sure that everyone knows how they work and how they do things. Our rationale is for old patients who are to have dementia, that they can use this. Most of them, sadly, don't know when they're urinating. So if they won't have to adjust to urinating in bed. They will just have to adjust to having a catheter placed outside, just slightly outside of themselves, hooked up to suction. See, these catheters there's a piece, and then there's a tube. The tube goes to a container, and the container is hooked up to wall suction. So it pulls the urine away from the skin, away from the person, away from the bed, And so our older patients probably won't have a problem with this. It might be a little bit more difficult for people who really want to get out of bed, but they can't. People who are mentally alert, who don't want to be laying in bed. Um, but yeah, we want this to work for everyone. So our rationale is to help the old people to not get urinary tract infections, because that would cause them mental clarity problems, heightens dementia, causes problems for their quality of living, and also just nursing staff and everyone involved. Um, our rationale is also to cut down on the medical waste, like I was saying. We don't want to have medical waste, as little as possible. We do have to throw away these urinary tract and these external catheters, but the amount of the amount of the amount of waste that they cause is very minimal, and they are also environmentally friendly to decompose. Um, the rationale is also not just to get rid of these expensive, to just get rid of these expensive antibiotics for the cost of the person, but most of the time, sadly, a lot of our people who end up with urinary tract infections are the elderly, are people who are disabled, and we're paying for it. I'm just being blunt. We are paying um, for their antibiotics. They're on government assist, and this will cut down on the amount of money used for government assist and free up more money to go towards other things. And it also provides a better um, quality of life for our population. So what we're going to do here is that we want to use it to its fullest potential. So we are going to show you a detailed plan of how we're going to do this. So Meritor, Unity Point Meritor has agreed to let us do this. We would like to do this trial, and I'd like to show you how. And the project deliverables here: less waste, so hospital and home health can not carry so many incontinent pads, save on money. It's more cleanliness than an infection. And getting an infection, it keeps that low. And it keeps less infection, so less medications. Less infections means less medications. And we want the patients to be satisfied. So I have a timeline worked out here. We're going to start on 9 Tower, the med surge floor, where they do a lot of knees and hips. They get the older folks who have fallen down and broken bones. They have the highest. One of the higher catheter uses for a non-trauma floor. So we're gonna unleash that on the 1st of November, and we'll run it until the end of November, 1st of December, and we'll get feedback if we're going to continue using it on that floor, if it's profitable, if it's not profitable, if it's effective. Then we go to the heart and vascular unit. This has a lot of patients who take Lasix and other what they're called water pills by a lot of people to flush out their system, get water off the lungs, get water out of their legs. So they end up having to urinate a lot. And so we're going to unleash that the 1st of December to the 1st of January next year. And then after that, we're going to try the 8 Tower, the neuro floor. This is where a lot of confused old people go, altered state of mind. Some of them already have urinary tract infections, but if they're going to be treated for it there on that floor, which most of them do, having this catheter would be an effective way to keep them from developing more of an infection or not fighting it off. Then we're going to try the ICU. The ICU has people who are completely knocked out. Most of them are sedated and intubated, and this would be a nice opportunity to see if these would work in that facility. Also, keeping them clean. I mean, they're going to keep doing peri-cares on these patients. We're not going to cut down on how often these people are cleaned up, but I think that the less moisture, the less urine will cause more healthy. And then we're going to do the 5 North, the birthing unit. The birthing unit, I don't know how well it'll work there, because I know they do want people to get up and move, but it might be something that could work there. That's the only floor I don't know if it'll work. 8 atrium intermediate care unit. It's a lot like the ICU. Only people aren't intubated, but you do have a lot of people who are bed bound and have a lot of tubes going on. It might be effective there. And then the emergency room, which again, I don't know if that'll work either. We're just going to try it hospital wide, and we will see how it works out. I hope it works out well. But the expected results for our resource benefits are participation in the plan will decrease the cost of antibiotics and hospital stays, like I've been saying. Most of the materials are located in the hospital anyway, except for the catheter itself. The tubing and the canisters and the wall suction is stuff that's all very common in all hospital rooms. We have that very accessible. And this plan is environmentally responsible by not having so much hospital waste, so that we're cutting down on hospital waste. I know a lot of hospitals have taken a lot of flack lately, especially since COVID, that we're wasting so much. And that's unavoidable, but if we can do something that is avoidable, let's do it. The health benefits are the lack of infection to the body, obviously. The being clean and dry will make people happier to be in their hospital stay. I don't know how many times I've heard from friends of mine who work in hospitals that they have gotten complaints from patients that they're wetting themselves and there's nothing you can do about it. But, that's just how it is. So this will be better. And really, we're promoting preventative care by doing that. Laying in a wet bed can also cause like pressure ulcers and stuff from forming. So we're doing preventative care for skin protecting and for the UTI factor as well. And it's giving patients a benefit of dignity too. I mean, it is what it is. This is a catheter that's going to be outside of them sucking out urine, but there is some dignity to it where they're not wetting themselves and feeling bad about it, Now, pricing is a little bit, we don't really know what pricing is going to be at this moment. Pricing will probably depend on the size of the orders that you do. The more you order, the lower the price will be. We're going to have to work out contracts and stuff. It's a little out of my department. My qualifications for doing this is that I have well over a decade in the healthcare industry. I've spent many years learning the details of medical equipment, and I have extensive research on Purewick, safe or effective for female patients. and I have strong ties to the community, and I want to serve them. I live in the same city as Meriter. I want our hospital to be one of the best in the world. So, in conclusion, I want to know if you think that if getting a new equipment is worth it for the patient dignity and for the sake of infection rate control. How much is too much? How much is too much to spend on this?